Good afternoon, it's Kelly, just moved that out of the way, speaking to you from the Ramsgate Clinic. It's a very bright day out there today, so I'm doing my very best to hide from the sunshine in my eyes. And I've noticed, goodness me, I'm frowning, I'm not used to that. So it's about time that I treat my own Botox before I start practicing or preaching. I'm not practicing what I preach. So next time, hopefully, you speak to me, I will be not frowning like that. Gosh, I don't like that at all. Anyway, so what I wanted to talk to you about this week, I feel like I haven't really made contact or touch base with you. Again, I have assignment brewing, and when the assignments are brewing, it all gets a bit chaotic in this house. Obviously, my little girl, as you all know, she's only 15 months. She takes priority, of course, so things like videos and social media can go to the back burner a little bit. But I have been continuing to professionally develop at a steady pace. So I am now almost a Dermalogica expert. I've been working really hard on my skincare. I've become a bit of a skin geek in the last probably about 6 weeks. I've been studying skin really hard. I'm prepping my menu to have facials back on the treatment list in Thanet, and I have been getting various little tools of the trade ready for you. Nurse Jamie here, she's quite big in America. Anyway, I've got her little sonic blade, so that's about getting much deeper extractions and cleansing on your cleansing module for your facial. But we will discover this more as I'm moving forward to bringing those facials back onto the menu. So those of you that see me in Faversham will know that Claire is our skin expert or skin geek in Faversham. That does not change. Only in Thanet will it be me that is doing any hands-on facial work. Okay, so what else have I been doing? I've been doing something or training in something called the Perfect Peel. Now, for some time, I have really wanted to be able to get my hands onto black or Asian skins, or anything that you would refer to as a Fitzpatrick, excuse me, put my teeth back in, grade 4 to 6. So historically, these skins have always been very tricky to work on because they can struggle with something called PIH, or post-inflammatory hyperpigmentation. Some of you guys may have heard of that. So what that basically means is when we damage the skin, or if they have a spot or a scar or whatever, the melanocytes go kind of a little bit crazy, and what they do is they really heavily pigment the area as a post-inflammation response. So as a aesthetic nurse or anybody that's any kind of skin expert, we need to be obviously aware of that, because what we're trying to do when we're working with skins is that we're trying to improve these type of conditions, obviously not cause problems. So it's always very prudent for anybody that is black or Asian skin to make sure that you're going to somebody that is experienced and is knowledgeable in things like PIH, because the last thing you want to do is go and have a chemical peel or a microneedling treatment or something invasive, plasmage, laser, something like that, and then come out with a bigger problem than what you went in. So I have been looking at specific types of conditions and how we can help people with those in the clinic. So some of those conditions, like melasma, for instance. Melasma is a condition that we will only ever manage, we will never treat it. So it tends to be of a hormonal nature, and obviously unless we are treating the hormones, which no one can really do, then it's very difficult for us to get on top of melasma. So I think if you have been diagnosed with melasma, it's very important to know that yes, skin clinics can help you, but they can't get rid of melasma because it does have that hormonal element to it. The best thing that you can do, guys, if you do suffer with melasma, is sun protection is your friend, and at least factor 30 to factor 50 is what I would recommend on the face. The ones that I use in clinic are Heliocare, very good, non-greasy, and another one called Altruist, which you actually can buy on Amazon very cheaply. Again, it's a great product. It's produced by a local dermatologist. They've done a really good job because it's really affordable and it's really effective, and that, if you miss that, is called Altruist. Okay, so back to what I've been doing with my treatment. So I've been learning something called the Perfect Peel. Now, I've been watching this for a few years, to be honest, and keep thinking, shall I, shan't I? It's quite an exclusive treatment, it's quite expensive to have done, but I bit the bullet and I've done the training, and I'm really pleased, or I'm relieved to say that I did so, because this is a great peel. So I, rather than calling it the perfect peel, which I can see why they call it that, to be honest, I think for me, it's the one peel. So it's the peel that you would come in and you would want transformative change with your skin. So obviously I'm gonna put a few contraindications onto that. So people that suffer with cystular acne, for instance, this is not going to transform that acne, because there's probably another reason for that underlying bacteria. For instance, P. acne bacteria, for instance, it can be causing a big problem. So if you are suffering with persistent acne, which is very troublesome, I would recommend that you go and see your GP or a prescribing nurse who could perhaps introduce some antibiotic therapy to you for a period of time, just to get that bacteria level under control. Also, another great thing that you can do is have LED blue light treatment, perhaps paired with some red light as well, will actually help to bring down the inflammation as well as control that acne. You can buy at home systems. I have a system here actually, which is called the Dees Pro. I don't know if that's available for people to buy at home. It's quite expensive, but LED, if you are compliant with LED, it is a fabulous at-home treatment alongside your medications. But I would recommend that you would probably be needing to do that probably about 3 times a week, to be honest. Anyway, I've digressed again, back to the peel. So the Perfect Peel has got quite a unique formulation. Its unique product is something called glutathione, which is an antioxidant property, which they use a lot. It's an amino acid, so they use it to help with skin health, but I also think it's got some lightening properties in there as well. So I'm going to have to refer to myself over here with what the ingredients are in there, because you know what I'm like, I forget these things. So the main ones that are in there are something called TCA. TCA has been around for years. It is a really good peeling property, so that is in there. Kojic acid is in there, again a lightening treatment, that's in there. Phenol acid. Phenol is like the big aggressive big boy when it comes to peels. So normally if you was having a phenol peel, you would be under a general anaesthetic, or you would be very, very close to a defibrillator because it can cause massive cardiac arrhythmias. Now it's in this peel, not in a very high grade, so it's about 8% in this peel, which is good because it will give you another element to your peel, but it's not going to cause you any cardiac problems or distress. Salicylic acid, I love salicylic acid. It's a BHA, so beta hydroxy acid, which basically means it likes to get into oily, congested skin. So it's very good at traveling that slightly more into the pore and unblocking, unclogging, and getting all that, rubbish really that causes us to get spots and things like that, getting it out. So that's really good. The other thing that it has in there, bear with me a moment, is retinoic acid. So retinoic acid, or retinol, that some of you may have heard it referred to, is a vitamin A product. It comes in different kind of strengths. So we start off with what we call retinoids, we go up to retinol, we then go up to tretinoin, which again is a prescription grade product, and then we go up to isotretinoin, which is quite often what you will hear people refer to as Roaccutane, or acne's not best friend, or best friend depending on how you want to say it. So Roaccutane is again a prescription medication for people that have severe acne. It can make people very, very sensitive. So actually, if you are using an isotretinoin product or a Roaccutane product, then we wouldn't suggest that you have this treatment done. So the Perfect Peel has got a blend of all of these ingredients in, which actually makes it a very powerful peel. So you don't need many of these peels. I think recommended is about 2, okay? And you would be expecting quite large peeling with this. So it's quite an active treatment in the fact that, quite often people come in and they say, I want a chemical peel, and I go, okay, and we do something, and they say, but I didn't peel, and I'm like, yeah, that's quite normal. You can just flake, or you know, just kind of scuff your skin, really. You don't always peel. Yeah, but it's called a chemical peel. And I'm like, yeah, I know, but you don't always peel. So the exception now to this is the perfect peel, where you're not going to flake, you're not going to scuff, you are going to peel, and you are probably going to be chopping little bits of your skin off because it looks a bit unsightly. This is great news, because skin loves to be damaged. Damaged skin will create all the wonderful anti-aging properties that we want to see. So things like collagen, fibroblasts, elastin, all those anti-aging heroes is what it will be produced by this peel. It will lift pigment out. Like I said, melasma we make no promises with because melasma is very difficult to treat, but I have seen some case studies with melasma, which was a very impressive result. But again, as soon as you go out to the sunshine, bing, melasma likes to return. So this is something that I'm going to do on myself, because as you all know, I won't do anything or bring anything into the business that I have not tried on me. And what I will do is I will do you a diary or a video diary of what that actually looks like. So don't expect me to be looking well presented or what have you. I might make the effort of doing my hair, but as for my skin, it's going to be, you know, a true representation of actually what having this treatment is like, because I want to be able to demonstrate to you what type of downtime you can expect, what does the peeling look like, how does it feel, you know, what's the treatment actually feel like. So my plan is that I'm going to do the treatment live, so you can all see what that entails, and then I will do a video diary for you of how my skin you know, sort of peels, and then how it rejuvenates over about probably 4 to 6 weeks will be my final result after having the peel. The Perfect Peel also has some prep products and some after products, which, to be honest, it's quite rare that something actually makes me go, ooh, that's quite impressive. But there was a product that was discussed on the training, which I think was called the Perfect A cream, and it's a combination of vitamin C and tretinoin, or vitamin A, and actually those combinations together are a real powerhouse for your skin. So you've got vitamin C, which is brightening and lightening, exfoliating to a certain degree, and then you've got tretinoin, which is treating fine lines and pigmentation and any probably acne, or you know, any sort of what I want to say, bacteria that is present. Tretinoin will help clear that, but it will also rejuvenate, replenish, you know, and get your skin really revved up with, again, those anti-aging properties, collagen, fibroblasts and elastin. So they, for me, are exciting things that we're bringing into the business. I just wanted to try and explain a little bit to you about it. I will plan to start my own treatment probably within the next couple of weeks, but I do try and touch base with you guys at least once a week or once every 10 days, just to let you know what's happening in the business. As for what's happening with me, what is happening with me, I've got an assignment due. I'm procrastinating like you wouldn't believe. So, you know, I find myself doing the ironing. Those of people that know me well enough know I don't do ironing, but I do when I have an assignment due. I'll iron anything, tea towels, bed linen, anything. And that's it really. So there's not too much that's going on, but there's enough to keep me busy. So I'm sort of squirreling away with learning about skin, because it is my true belief that, you know, you're the master when it comes to your skin. I'm the framer. I've always said this. So you're the artist. What you do every day will build the beautiful, perfect picture. And then when you come to see somebody like me, it makes the job for me so much easier, because I just pop the frame around your lovely piece of artwork. So everything that you do at home with skin, you know, if you're using active products and things like that, is so important, because then it makes my job 10 times easier. Anyway, that's my little update for today. I hope you're all well, and I will speak to you very soon. Big love.